Hello, my name is Murray Lumpkin, and this is the first of several modules that deal with the issue of the regulation of medical products. In this first module, we're going to be talking about why do we regulate medicines in the first place? And I hope by the end of our time together that you will have a better understanding of the development of the various approaches to regulation that were undertaken in the United States and in the European Union, and that you have a better understanding also of the mechanisms that the US and the EU use, some of their similarities and some of their differences in the terminologies that they use. The real purpose of this first module is to give you a good foundation in the history of the regulation of medicine so that in future modules we can talk more in depth about how medicines are regulated in high-income countries, how they're regulated in low-income countries, some of the impact that recent globalization has had on the regulation of medicines, and then at the end, perhaps share some thoughts about where regulation might be going in the 21st century. But let's begin by asking the question of why do we regulate medicines? I think as we go through and look at this question, there are some recurring themes that you will hear over and over. And one of the major ones is that, at least in the United States and in the European Union, regulation was not something that was really prospectively thought about and discussed to a great degree and then organized and put into effect. But rather there was, from a historical perspective, usually a large-scale public health disaster that ended up being the catalyst for the public demanding some kind of legislative change. And I think what you'll see is most of the history of medicine's regulation has been much more of a reactive kind of history, a history that has to do with how do we control things better so that we don't have future public health disasters of the kind that led to the various changes in how we now regulate medicines. But I think you'll also see in some of the more recent history of the regulation of medicines actually some more of that proactive thinking I was talking about, where people are trying to think, how can we use the regulation of medicines as a way to address some of the special public health needs that we have today? The second recurring theme that I think you will hear about today is that the authority to regulate medicines in the United States and in the European Union is generally not a public health authority, but rather a commercial authority. In the U.S., this is found primarily in the Commerce Clause of the U.S. Constitution, and in the European Union in the free movement of goods provisions within the EU treaty. And I think this will have, as you will see, a profound impact on how these products are regulated, why they are regulated, and what it means from the perspective of the practice of medicine. In the United States, really prior to 1848, the regulation of medicines was primarily done by the states under some of their public health remits. This was very inconsistent from state to state, and while it might have been effective early on in the history of our country when most of the products were manufactured within a state and sold within a state, obviously, as the country grew and as commerce within the country grew, this was not going to be an effective way to regulate products that were being sold across the country. There had been, in 1813, an earlier Federal Vaccines Act, but it was rather short-lived. And also a very important part of the history of medicine's regulation occurred in 1820 with the formation of the U.S. Pharmacopoeia. This really was the first compendium of drug characteristic standards in the United States. And while the U.S. Pharmacopoeia is recognized in U.S. law, it is not part of the federal government. It's one of the few pharmacopoeias in the world that is a private sector entity, as opposed to being a part of the regulatory authority of that particular jurisdiction. In the mid-1800s, it became clear that with the growth of the United States, the U.S. was becoming a dumping ground for fraudulent products. And really the first federal effort in regulating medicines was to look at the imported medicines that were coming in, and they were looking not to think about in terms of safety, efficacy, and quality like we do today, but rather primarily they were looking at fraud and whether indeed what was coming in was what it said it was. We also, as the country went further into the 19th century, with the growth of railways across the country, with the greater movement of products and people across the country, it became an era known as the era of snake oil medicine in this country, of worthless products that were being touted by salespeople who took the trains from one city to the next city and were basically, again, giving people things that were fraudulent and things that perhaps many times did more harm than good. One of the initial efforts to deal with this was out of the Department of Agriculture with an individual by the name of Harvey Wiley, who is thought of as the ultimate father of modern regulation in the United States as we know it. He set up what was known as the Poison Squad at the Department of Agriculture, and he and the people who worked for him were primarily interested in looking at products that were being sold for fraud and trying to expose the fraud that indeed was happening at that point in time. In the early 20th century, we had what was known as the beginning of the modern era of regulation of medical products. And it started in 1902 with the Biologics Control Act, which subsequently in 1944 became what we still know today as the Public Health Service Act. This was a law that focused on some very new products that were beginning to come and to be used to come on the market in the United States and to be able to use much more widely. And these were primarily the vaccines and the sera that were produced at that point in time to treat some of the diseases that heretofore had been unable to be treated well. But because of the way these particular products were manufactured, they often had many impurities in them that caused significant problems. And I think you'll see as we go through the history of regulation, particularly looking at vaccines and biologicals, that because of the very complex nature of the way in which they're manufactured, specific kinds of regulation and specific oversight is required in order to produce products that indeed are high quality products and products that do not have the problems with some of the early impurities that were seen in the early part of the 20th century. This was also a time of great progressivism in United States politics. It was the time of President Theodore Roosevelt. And it was also a time when many in journalism were pointing out some of the various things that were going on in the country, such as in the meatpacking and food service industries, that when they were exposed, again, as we said earlier, there was basically a public outcry that these kinds of activities that were producing products in the food industry and also in the medicines industry that were harmful to people should not be allowed to occur. And so in 1906, the Pure Food and Drugs Act was passed by the U.S. Congress, and this was the first time that the federal government was given the power to actually remove a product from the market if indeed it was fraudulent. As opposed to what you'll see ultimately, how these authorities have further evolved, this was not a marketing authorization in any kind of sense like we think today. In fact, they didn't even need a marketing authorization in order to put products on the market in 1906. But the federal government did, for the first time, have the power to take products off the market if the government could prove that the manufacturer intended to defraud the person who bought the products. Now, there were many shortcomings in this act, and there were multiple attempts to rectify these shortcomings legislatively, even up until the early 1930s, but really to no avail. Some of the things that happened in that time, in the 1930s, was that what we now know today as the Food and Drug Administration was established as an entity within the federal government, as an organization that had grown on the foundation that Harvey Wiley started with his poison squad in the Department of Agriculture. The original FDA was part of the Department of Agriculture until 1940. And again, when you remember that the F stands for food, you can understand why originally it might have been put in the Department of Agriculture. During World War II, it was moved to the Federal Security Agency, and there it remained until 1953, when really its public health impact was recognized not only from the perspective of food safety, but also the safety of medical products. And it was moved to what was then called the Department of Health, Education, and Welfare, which was the forerunner to the Department of Health and Human Services that we now know in the federal government. The FDA was never set up to be an independent agency. For example, the Environmental Protection Agency does not report to any particular department. It is what is known as an independent agency, and it even has a cabinet-level rank. The Securities and Exchange Commission is also an independent agency. But FDA, on the other hand, probably based on its history and the way it slowly came into being in the latter part of the 19th century and the early part of the 20th century, has always been part of a department and reports to a cabinet-level secretary. As I had mentioned, in the early part of the 20th century, up until the 1930s, people had tried many times to rectify some of the shortcomings that they found in the 1906 law. And in 1937, there was a public health crisis in the United States that finally gave the impetus for the public outcry that Congress change and regulate medical products in a way that was more stringent than had been done previously. What happened at that point in time has been known as the elixir of sulfanilamide incident. And this was a situation where antimicrobials were just coming in at that point in time. People were recognizing what an important role they played, that they were able to deal with infections that previously had been death sentences, both to adults and children. But one of the problems with them early on was that while they could be made into tablets, because of their chemistry, it was very difficult to make them in a dosage form that children could take more readily. And so some people decided that perhaps if they mixed it with a certain solvent, they could put it into a form that children would be able to take in a much easier manner. Unfortunately, the solvent that they used was one that was quite similar to antifreeze, and it ended up killing 107 people in the Midwest and in the South. Mainly, there were children that were killed, and it really dramatized for the country the need for a change to try to make sure that products were indeed as safe as they could be prior to their going on the market, and not finding out about major safety issues once a product went on the market. And this elixir of sulfanilamide incident was that public health situation that caused Congress in 1938 to pass what is known as the Federal Food, Drug, and Cosmetic Act. And this is still the major federal law that governs food safety, drug safety, and other kinds of product safety that fall under the jurisdiction of the Food and Drug Administration. Now, obviously, it's been changed and amended many times since 1938, and we'll talk about that. But really, the fundamental important fact about the 1938 were two things. Number one, it required the manufacturer to show that its product was safe prior to the product being put on the market. And they had to show that to FDA. So this was the beginning of having to get permission from the federal government to market your product when you have shown that your product meets a standard that the federal government sets. This was just a safety standard, and we'll see as we talk a little bit further how other standards came into being. The other part that was really important on this particular piece of legislation was that FDA no longer had to prove that the manufacturer intended to defraud a person when indeed a product was misbranded. That the fact of the misbranding, and that means the fact of saying that the product was something that it's not, or that the product would do something that it didn't, the fact that indeed you labeled the product, you put a brand on the product, you misbranded your product, was enough to also give FDA the authority that it had had since 1906 to remove a fraudulent, misbranded product. But now the threshold no longer was showing that the manufacturer intended to defraud, which was a very high threshold indeed. After the 1938 new law came into effect, there were many things that were happening in the world and in the technology of the development of new types of medicines that required many amendments to that act to address these new ideas in science and public health. Many of these obviously came out of efforts during World War II to deal with many of the diseases and situations that came as a result of that conflict. In 1941, we had the insulin amendments to the Act with the development and marketing of insulin. In 1945, the penicillin amendments that dealt with some of the specifics around this new product that had been developed and was manufactured in a very, very special way. And then in 1951, in the post-war years, there were amendments that began to really clarify across the country what it meant as far as a drug having to have a prescription in order for it to be dispensed, and what it meant for a product that could be purchased over the counter. And so prior to 1951, the clarity and the consistency of when one needed a prescription and when one didn't, and what could be marketed and where it could be marketed and by whom it could be marketed, was really quite ambiguous across the country. After the 1951 amendments, we had much greater clarity as to, again, what required a prescription, what had to be obtained from a pharmacist, and what, on the other hand, could be bought over the counter. But I think as you'll remember from what we've been talking about over the last several minutes, we still didn't have any requirement that a manufacturer was required to prove that the product that they were selling actually did what it said. So far, all they had to be able to prove was that it was safe and that it was labeled appropriately, that it was not misbranded or that it was not fraudulent. And then we had another one of these major public health events that caused people to pause and to think about whether we needed to modify how we regulated products here in the United States. And that was the 1962 thalidomide disaster, which actually did not occur here in the United States, but occurred in Europe and Canada and many other countries, where a product was allowed on the market that was thought to be a safe aid for sleeping. It was given to pregnant women, and it caused major teratogenicity, or major deformities, to occur to the children that were born to women who took this particular product while they were pregnant. Obviously, with the availability of the news media at that point in time, what was happening in Europe, the disaster for these families and for these children, became well known here in the United States. and it prompted Congress to pass in 1962 what are known as the Kefauver-Harris Drug Amendments. These amendments did several things to the way we regulate medicines, but probably the most long-lasting, impactful thing they did was to add what we call the efficacy requirement, meaning that products that came on the market from 1962 on had to require that they not only showed that they were safe, but that they did what they said they did. In essence, they had to show what the benefits of their products were, they had to show what the risks to their products were, and they had to show that the benefit to risk profile of their product was positive. And they had to do this to the FDA prior to getting permission from FDA to market that product in the United States. So in the first half of the 20th century, you see this progression from basically no authority to the authority to remove a drug if you could show that the manufacturer intended to defraud the purchaser, to a situation where you had to show that the product was safe, to now in 1962, a situation where you had to show that you had a positive benefit-risk profile before you were allowed to market your product.